The experts that care for you at Des Moines University Clinic are more than just clinicians. They're researchers, teachers, and mentors who are training tomorrow's healthcare professionals. Call today or visit dmu.edu/clinic.
Hi everyone, my name is Lane Heinlein. I'm with the DMU Anesthesia Club, and we want to give a presentation on pain journaling, and specifically how to do it and why it's helpful. So to kick things off for this pain journaling lecture, I wanted to lay out a definition of what pain is. As med students and future physicians, we learn a lot about pain, and this is one of the definitions that we've learned. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. This is a definition from the International Association for the Study of Pain. I like this definition because it lays out the truth that pain is not just a physical symptom. It also involves emotional and all these other aspects of life as well. So I think it's important to recognize that as students, medical students, and future physicians, we're being taught that pain is more than just a symptom. When you come in, we understand it has this emotional aspect as well. And so the goals to address pain is to have us, the physician, and you, the patient, work together to resolve this so that we can get you back on your feet and hopefully going through life back to normal. I think pain journaling is a great way to prepare for doctor visits. It's a helpful tool to keep track of all of your pains and experiences, and having these details is helpful for when you go into the doctor's office and the nurse or the doctor is taking a history on your complaint. And often when you have these details, it helps get a better history, and when the doctor is able to get a better history, there's often more confidence in the diagnosis. And when there's a more confident diagnosis, it's often easier to move forward with the treatment plan, and hopefully that all leads to just a better outcome and a better experience for you. As medical students, one of the first things we learn to do is how to take a thorough history. The first part of taking a history is called the History of Present Illness, or an HPI. This kind of explores all the details of your chief complaint or why you're visiting. I think it's important that I talk about what we learn and all the questions we learn to ask, because that'll help you know what details we're looking for in your pain journaling. So the acronym we use for our HPI is OPQRST. So for the next couple slides, I wanted to walk through what each of these letters mean and some of the details that they cover, so that when you're doing your pain journaling, you can keep these things in mind so that you have answers to the questions that physicians will be asking when you go in for a pain visit. The first letter of our HPI acronym is O, and O stands for Onset. One of the first things that you'll be asked when you go in for a pain visit is, when did your pain start? Was it months ago? Was it a chronic pain? Or is it just in the last week or so, a couple days where it's more acute? This helps the doctor narrow down kind of two huge differences between pain, whether that's chronic or acute, and also just having this detail of when it started, if it started with any other events in your life, is super helpful. The second letter of our HPI acronym is P, and P stands for a number of things, namely palliation, provoke, progression, and previous episodes. So when you're journaling this or keeping track of how you're pain, what we mean by palliation is there anything that makes your pain better? When you lie down, does it get better? When you're up walking around or doing things, does it get better? When you're when you're asleep, does it get better? Anything like that. Provoke, does anything make your pain worse? Again, the same things when you're up and walking around, does it get worse? Does it get worse when you're lying down? When you eat food, does it get worse? Stuff like that. So anything that makes it better, anything that makes it worse. Progression is also important. So after your onset, how has your pain progressed? Has it gotten worse? Has it gotten better? Has it stayed the same? Off and on, all that sort of thing. In previous episodes, it's sometimes helpful to know if you've had anything like this before. Has this pain, is it similar to an episode that you had 3 or 4 years ago? Did it happen a couple months ago? Or maybe it's never happened before at all. It's something completely new. So this is a big piece of the history that I think is very helpful. The next letter in the HPI acronym is Q, and Q stands for quality. This is kind of a subjective topic and it's hard to describe, but when you're journaling your pain, if you can give some adjectives describing it, it's helpful. Some adjectives that we hear a lot and are helpful are the pain's burning, if it's aching, does it wax and wane, is it sharp, is it dull, is it localized, does it kind of spread out? Just anything is helpful when you're thinking about this, but how would you describe the pain? Put the pain in your own words. The next letter is R, and R stands for region and radiation. Another big question that they'll ask, obviously, is where is your pain? So if you're able to point to where it hurts, that's super helpful, obviously. But also something to note is, does it radiate anywhere? Does your pain start at one point and kind of extend to another point in your body? The combination of region and radiation along with the quality of the pain is very helpful and gives a lot of details to what you have going on. The S in the acronym stands for severity, and this is another one that's pretty subjective. It's hard to pinpoint down a value on a scale of 1 to 10. So what the doctor would actually find more important is, what is the pain keeping you from? Is it keeping you from doing anything in your daily lives that you typically do? Does your pain wake you up at night? Just general things like that. It's hard to put it on a scale of this is a 6 pain versus this is a 4 pain, but if you can give some details on what it's keeping you from, if it's stopping you from doing anything, that's generally more helpful. And the last letter is T, which stands for trauma, treatment, and timing. Trauma being, was there a specific event that caused this pain? Did you have a fall? Did you get hit by something? Anything like that where the pain was immediately or directly caused by that. Treatment, have you been doing anything to treat the pain? Have you been taking medications? Have you had any other therapeutic treatments like chiropractor or heat pad, or if you're taking supplements or anything like that? And timing is also really important. Does your pain fluctuate throughout the day? Again, does it wake you up at night? Things like that are always helpful to note when you're journaling. A few other things that might be helpful outside of the HPI acronym or just if you have any accompanying symptoms with your pain. Do you have any nausea, vomiting, diarrhea? Have you had any sudden or unexpected weight loss? Stuff like that. Anything out of the normal that kind of came along with your pain, kind of presented with it. Another thing to keep track of is any medications you're taking. This includes any supplements, vitamins, stuff like that you're taking daily that doesn't necessarily have to have started taking when your pain started, but just things that help everybody keep track of what you're consuming. So I know that was a really brief introduction into a small piece of the history that we as medical students are learning about, but I thought that that would probably be the best way to show you guys some of the details that we look for when we're asking about pain. So if you know the details that we learn about, then it'll be a lot easier for you to journal about them and take that information with you when you go to the doctor. So I hope these few minutes have been helpful. And as always, if you have any questions about pain or different things that you're trying to keep track of, it's always best to call your primary care physician and check with them. So thanks for your time, and I hope you have a great rest of the day.
At Des Moines University Clinic Physical Therapy, our providers are experts in movement and improving your overall health and function. We pride ourselves in focusing on the whole person and develop rehabilitation programs that address the psychological, social, and physical aspects of your pain and functional impairment. Our state-of-the-art facility includes private treatment rooms for your privacy and comfort. The technology utilized by the expert clinicians facilitate the outcomes of the rehabilitation program. We provide general orthopedic rehabilitation following surgery or injury, along with the treatment of aches and pains that occur from aging or living an active lifestyle. We have therapists that have advanced training and specialty clinics for vestibular, balance, and concussion recovery, We also treat many neurological conditions, like the recovery from a stroke or Parkinson's disease. We have specialty training in the management of persistent pain conditions and strive to improve the quality of life and to keep you moving. Another specialty clinic is working with men, women, and children that have pelvic floor problems with incontinence or leakage of bowel and bladder, constipation, pelvic pain, perinatal care, or the recovery from cancer or pelvic surgery. Although many individuals may not need rehabilitation, they can benefit from a wellness assessment to help improve movement that will reduce the risk of injury and improve general wellness. The physical therapy wellness exam is designed for all ages as an assessment of an individual's flexibility, strength, walking, balance, and aerobic conditioning.